Hello, and welcome to another episode on the Wellness and Recovery Podcast. Today's episode is called Healing the Hijacked Brain, the episode where we dive deep into the science of addiction and recovery and empower our community with knowledge and compassion. I'm your host, Zachary Rios, an Adult-Gerontology Primary Care and Addiction Treatment Nurse Practitioner and the founder of Rios Enterprise. I've had the privilege of working alongside countless patients on their journey to recovery, and I'm here to share what we've learned, because healing people begins with understanding. Today's episode is all about opioid use disorder, what it does to the brain, why it's not just about willpower, and the life-changing medication we use in the treatment. Let's start with the basics. Opioid use disorder, or OUD. Opioid use disorder is a chronic medical condition characterized by the compulsive use of opioids despite harmful consequences. These opioids can be prescription pain medications like oxycodone, hydrocodone, or illicit drugs like heroin and fentanyl. But here's the key. Opioid use disorder is not moral failing. It's a brain disease, and like diabetes or heart disease, it changes the way your body functions, especially in the brain. To understand how opioids hijack the brain, we need to talk about neurotransmitters. When someone uses an opioid, it floods the brain's reward system, particularly the mesolimbic pathway, also called the dopamine pathway. Here's what happens. Opioids bind to mu receptors, which are densely packed in areas like the nucleus accumbens, amygdala, and the ventral tegmental area. This triggers a massive release of dopamine, the feel-good neurotransmitter. The brain gets the message, this is great, let's do it again. But with repeated use, the brain adapts. It downregulates the dopamine receptors, meaning it becomes harder to feel pleasure, not just from opioids, but from anything like food, music, relationships, sex. All things that you used to get pleasure out of, they start to now not matter or become less intense in the pleasure that is being received. It shrinks the gray matter in the area involved in decision-making and self-control, like the prefrontal cortex. The amygdala, which processes fear and stress, becomes hyperactive. This leads to increased anxiety and dysphoria during withdrawal. This is what we call neuroplasticity gone wrong. The brain remodels itself around the drug, creating a new normal that prioritizes survival behaviors centered on opioid use. Now for the hopeful part, just as the brain can remodel in unhealthy ways, it can also heal, particularly with the right tools. And some of the most powerful tools we have are medications for opioid use disorder, also known as MOUDs. I'm going to break them down for you. There's a few different types. First, we'll talk about the buprenorphine derivatives, such as Brixadi, Suboxone, and Sublocade. They have the same mechanism of action, which is a partial opioid agonist, and it activates opioid receptors, but only partially, so it reduces cravings and withdrawals without producing a high. It affects the neurotransmitters by stabilizing dopamine levels and reduces the brain's stress response. These medications come in different forms, such as sublingual tablets, films, and weekly and monthly injections. Then you have methadone, a full opioid agonist. It's longer acting and can be taken under supervision in a certified opioid treatment program, which many of you guys may know them as methadone clinics. It affects the neurotransmitters by preventing withdrawal and blocking the euphoric effects of shorter acting opioids like fentanyl. It's especially effective for patients with a long history of severe opioid use disorder. Then you have naltrexone. Naltrexone is different than these two as it is an opioid antagonist and blocks the opioid receptor completely, so if someone uses opioids, they won't feel the effects. Naltrexone comes in an oral tablet form or a monthly injection. These patients must be opioid-free for 7 to 10 days prior to starting naltrexone, or it can put somebody into what is called a precipitated withdrawal. These medications don't just help people stay sober. They give the brain the space and time it needs to rewire. With consistent use, many of the structural and functional brain changes caused by opioid use disorder can begin to reverse, and you can see positive changes. So I want to leave you with this. Opioid use disorder is one of the most treatable chronic illnesses we know when we treat it like a disease and not like a crime. The combination of medication, behavioral support, and community resources can transform lives. And as someone who works with these patients every day, I've seen that transformation happen. Whether you're a provider, a loved one, or someone navigating your own recovery, know this: there is hope, there is healing, there is help, and people do care about you. Thanks for tuning into Healing the Hijacked Brain. If you found this episode helpful, be sure to subscribe and share it with someone who might need to hear it. For more information, resources, or to work with me directly, visit omegaphysicians.net or follow me on social media. Until next time, take care, stay informed, and never stop believing in the power of recovery.